Well, a new report has raised concerns about access to and the affordability of timely healthcare in Australia. The Australian Patients Association surveyed more than 11,000 people across the country. It found the top three issues are private health costs, wait times at emergency departments across the country, and access to mental health care. Here's the gap between experiences at public and private hospital emergency departments. 54% of people surveyed were satisfied by their experience at public hospitals. That's compared to 72% at private hospitals. In terms of access to mental health support, almost 60% of respondents in New South Wales, Queensland and Victoria are waiting more than 3 months for help. In South Australia, it's even worse, with 67% waiting 3 months or more for support.
Certainly there's a greater 40% more people are seeking mental health services than prior to the pandemic. It has been exacerbated by the pandemic, but also exacerbated by the concerns people have around economic security and general uncertainty and fear of the future. So there's much more anxiety, depression, eating disorders and addiction coming up in mental health conditions than there was prior to the pandemic.
But the top issue was private healthcare. You can see here that every single person surveyed in the Northern Territory believes that the cost of private healthcare is poor value for money. It's not much better in the other states and territories. Queenslanders are the most satisfied, but even 72% of respondents there believe private care doesn't offer enough return on investment.
I think what alarmed me the most in this is the reports about private health insurance. When you look at all of the companies that set up, there's iSelect and there's many others that try and help people compare, the reality is that it is not transparent for consumers. It doesn't make sense to them. They can't see what they get, and it's hard to access private health insurance, particularly for mental health. So it's the rising costs and the lack of transparency. That surprised me because I would assume that would have been addressed by the industry.